going to be Rosemary Jackson.
Right. Okay.
Rosemary Cornwall. That's the next.
Rosemary Colvin. Okay. Thank you. Come in. Hello. I am Rosemary Cornwall.
Hi.
I'm Dr. Levine. Right. I see you're a new patient to our practice. Is that right?
Yes.
Welcome.
Thank you.
Okay. How can I help you today, please?
Well, I've been told that I had to make this appointment, and the nurse made it for me, I think, this
I see.
morning as an
Okay.
emergency extra.
Right. Okay. And did she say why this appointment was
Blood
necessary?
pressure.
Right.
My blood
Okay.
pressure was worryingly high.
I see. Okay. Obviously this sounds like this is a surprise to you. It's never been the case.
No, I mean, to be honest, I know my blood pressure's high. I
Right.
was just surprised by her reaction that
I
I
see.
needed to see you as a matter of urgency.
I see. Okay. So you're known to have high blood pressure.
Yes.
Are you on treatment for blood pressure? at
No,
all?
I'm not.
No. Right. Okay. So if I may ask, if you don't mind, how high has it been before?
In
how
terms
long?
of numbers,
Yeah.
I have no idea.
Right, okay.
It's been high for many years.
Mm.
I've had multiple conversations with my GP in London about my blood pressure
Right.
and about what my percentage chance of death from something
Right.
horrendous like a heart attack or stroke is.
I see.
I think the last figure off the top of my head was 36%.
Right.
That was quite some time ago, and
Right.
bearing in mind I'm still here now.
Right.
Yeah,
Okay.
so I do know I've got high blood pressure.
Right. Okay. So in the morning you had the consultation with the nurse. She flagged up the issue about your blood pressure. Was there anything else she also asked for you to see me about?
No, that was
No,
it as far as I was aware. I
Okay.
had some blood tests done as a new patient check,
Right.
but that was done a couple of weeks
Couple
ago.
of weeks. Do you know what the results of those are?
No.
No. Okay, that's fine. I see also from your results that, from your notes that you have got a background history of type 2 diabetes.
That's right, yes.
And also you're on some medication for epilepsy. Is that the case?
That's correct.
Right, okay. Just to talk about the issue about the blood pressure, yes, it is high. Obviously, it's difficult for us to say how high it's been in the past, given the fact that you're new to us and you don't really know what your figures have been.
Mm-hmm.
But yes, it is at a level where we would consider it to be an urgency, basically, with the figures of 188 over 120.
Right.
Now, just going along that line, I need to ask a few questions about, whether you've had any symptoms at all. Now, specifically, have you had any headaches or blurring of vision?
No, nothing
No.
like that.
Right, okay. No blurring of vision as well. Right, okay. Any chest pains at all?
No,
No. Shortness of breath?
no.
No. Right, okay. And I also noticed that from your blood tests, the ones you had recently, we checked your cholesterol levels. We also checked a marker for, your control of blood sugars. From your notes, I see you're not on any treatment for blood sugar?
No.
No. Right, okay. Now, I'm afraid that the results are also high for your cholesterol. You've got a level of 7.2.
Right.
Okay. You have also got HbA1c, which is just, like I say, a marker for what your blood sugar control has been over the last 3 months. Is a little bit raised enough for us to need to do something about it, basically, at 8.1.
Right.
Now, putting all of that together, we do have a software on our computer that does, like you say, calculate the your potential risk of heart disease, strokes, and things like that. And it's come back with a risk that's significantly raised as well at 49%.
Right. So it's gone up from the last figure.
It sounds like so. Right. Do you understand so far what what I'm explaining?
I think so.
Now, about the blood pressure, I think we need to do something about it urgently. Now, the reason is, if you were, I mean, we know you've got high blood pressure, you've always had, but you're not on treatment for it. Now, at a level of 188 over 120, I'm particularly concerned about the 120 as well. I think we need to give you something to try and bring the blood pressure down. Now, do you have any, thoughts about, starting you on something to try and control your blood pressure?
I don't want tablets.
No. Right. Okay. Is there any particular reason why you don't?
Well, I already have my phenytoin, which you can see I have to take every day, and have been told I have to take that for the rest of my life. My understanding of blood pressure medications, unless I'm mistaken, is that that will also be something for the rest of my life.
Right.
And to be honest, I've moved here to change my lifestyle, and I understood that that would have an effect on my blood pressure, and I don't feel like I've been given a chance to do that yet. So, in response to your question, no, I don't want tablets.
Okay. I understand, obviously if you have been told with the percentage of your risk of, strokes, heart attacks and things, it's not happened basically all these years. And obviously you have moved because you wanted to change, your lifestyle. I'm afraid at that level, I'm not convinced that a change of lifestyle would actually be able to bring it down significantly enough to a normal level. And considering the other abnormal results that I explained to you, the cholesterol, the high HbA1c, the marker for your blood sugars, I think it's worth us doing something about it, really. I completely understand where you're coming from about, being given the opportunity to actually change your lifestyle and amend things. If I may ask, what have you done exactly in terms of your lifestyle modification?
I've only been here a couple of weeks. I bought a bike.
Right.
I was planning on
That's really
exercising more and losing weight and
Okay.
cutting back on fatty foods and alcohol. I mean, correct me if I'm wrong, but these are the right things to be doing, isn't it?
You are doing absolutely the right things, yeah.
This was my plan. I'm slightly frustrated that you only have one blood pressure on your system. You don't know what my previous blood pressures are like. So it seems a bit sort of left field to suddenly start tablets now when I've had high blood pressure for some time.
I understand. I mean, normally, because you've told me that you're known to suffer with high blood pressure, normally what the protocol would be to check your blood pressure immediately. You could check in a couple of weeks, or, as the new guidelines state, would actually refer you onto the hospital to have what we call an ambulatory blood pressure monitoring, which is basically they check your blood pressure while you're mobile, all through for a 24-hour period, and see if it's persistently raised. In which case it would be a cause for going on to treat. But because you're known to, you've told me already that you know that your blood pressure has always been high, even though you don't have the figures, and then this result is that high. I mean, if you were 80 something, you came to me with this blood results, even though I would need to bring it down, I wouldn't be as aggressive in my management as I would be for yourself, because I mean, you're 56. It's very important that we try and bring it down to as close to normal as possible. I mean, which would be considered less than 140 over 90, or 135 over 85 if you had to go to do it in a hospital.
Right. So what does that mean today?
Today, I think we need to, if you're happy, for us to start you on a tablet, it's a class of medication called the calcium channel blocker. Basically, it would help to bring down your blood pressure. At the same time, I would like to, I see that you're diabetic, but you're not on any medication for your cholesterol. I think we need to talk about that as well.
Right.
Okay? I mean, we don't have to start something for that right now, but if you don't mind making an appointment in the next week or so for us to discuss about that further.
Right.
Okay.
Well, I don't mind making an appointment to discuss everything further, but I don't want to start a tablet.
Right. Okay. I really think it's important. I really think it's important that we, like I say, it's very unlikely that just lifestyle modification would be able to bring it from 188 over 120 to less than 140 over 90.
But I haven't tried that yet.
Right.
So we don't know whether that will or won't work.
Okay. Right. So I mean, you would prefer to try it for a while and then.
Yes.
Right. Okay. Okay. I mean, it's entirely up to you, but my advice would be for us to do something about it immediately. I completely understand, obviously, if you're not happy to go along with that. I would, however, need to advise you about, things to look out for. That would mean you probably need to see me sooner.
Right, okay, Tosin. 10 minutes.
I know.
You want to set it for 9 actually,
All right.
because then you've got a buzzer that tells you
When to start?
when you seem to think about winding up. You can't take it in the exam, but
No, I know.
okay, right, lovely start. Welcome to the practice. What could be better? That's really nice. Now, genuinely, I mean it. It's a really nice start. It's a really, it helps to soften the patient up a little bit.
Right.
Let's just go through it because there's a lot to get through here.
Right.
If I may ask you, if you don't mind, she's here to be asked questions. You don't
Okay.
have to ask permission to ask the question.
Okay.
You wasted 15 seconds of your life doing that. You don't need to do it. Just ask the question.
Okay.
She's not going to say no. Okay, you established quite clearly that this was a long-standing problem with her blood pressure that had been identified before, treatment offered, but treatment resisted. Okay, and that's a pretty big cue for later on when we're looking at the management side of things. So I want to come back to that bit. You then asked some good sensible questions about any visual symptoms, any headache, any shortness of breath, any chest pain. Very good. You didn't ask some very important questions like smoking, alcohol, caffeine, diet. Okay? Yep, you can stare at it all you like. You can ask the questions. And you have identified clearly that there's only one reading here, yet you didn't take the opportunity to get a second reading. Okay? So no examination, no fundal examination, no heart examination, no blood pressure. Okay. You then went into an explanation of blood pressure, which was good, and you recognised the lack of background numbers, but you also recognised that the history was there, but you just didn't have the numbers to augment the history. You talked about the bloods, you talked about cholesterol being up, the HbA1c, which you said out loud, which I'm not overly keen on, but you immediately gave a good explanation of what that is, so that's okay. And you talked about the risk calculation being 49%. You then said, do you understand so far? Well, there was this, the thinking behind it was right about what did she understand, but you said, actually quote you, do you understand so far what I'm explaining? And there's a lot of you knows going on, so just be careful about that. You then said you need to do something with blood pressure as a matter of urgency, something to bring it down, and then you talked again about why she'd not had medication before, and then Kat wants to talk about lifestyle. Well, it's very difficult for you to comment on lifestyle without actually knowing what a lifestyle is, because you haven't taken a proper history. How can you, because if she's 60 a day, 3 bottles of wine a day, and 6 bags of crisps a day, and she's going to do all of that, and you haven't asked any of it, you don't know the degree to which the lifestyle modification is going to make a difference. And you're talking about treating on what is effectively one reading. So I thought your approach was a little bit too doctor-centred, actually, by saying things like, I completely understand, but this is what we're going to do, or this is what I want to do. And you talked about referring her to a hospital for ambulatory monitoring. Do you not have that opportunity to do it in-house? Do you not have the machine? So some surgeries do, some surgeries don't. Fine, that's okay, that's fine. Okay, so I think your manner's really nice. You've got a really nice, relaxed manner, smiley face. I like the welcome at the beginning. So your interpersonal work is good, except the listening bit. I don't think it's a little bit doctor-centred. The reality here is this woman has had high blood pressure for a very long time. You don't have a quantifiable number on that, but you can get one by looking at her old notes. So you can corroborate the evidence that you've got currently. Would you ever treat on a single reading?
I mean, I think I came across this, correct me if I'm wrong, if it is that significantly high, you do need to do something.
Well, I think it's about context, because if you look at her old notes and it's been 180, 175,
Right,
180 for
sure,
years,
sure.
then you don't need to do anything today.
No.
What you need to do today is to
Check
get
it,
this
yeah.
patient on side. so that
Okay.
you're working together. She's clearly an angry woman, and you need to get her on side. Right, anyway, we don't know what your next case is, but it's not that one.
Okay, thank you.
Okay.
Come in. Hello. How are you doing? Dr. Lavini with Stephanie Hill?
Yeah.
Oh, thank you, sit, please. Right, Stephanie, how can I help you today, please?
I think I'm pregnant.
Right, okay. Can I ask when your last menstrual period was? When was the last time you had a period?
5 weeks ago.
5 weeks ago.
Yeah, I'm a
Right.
week late, so I did a test and it said I was pregnant.
Right, okay. Sorry, can I just ask how many tests you've done?
Just one
The
for
one-
boots.
Right, okay. That's fine. Are you here by yourself today?
Yeah.
Right, okay. Now, can I ask, does anybody know about this in terms of your parents?
One would kill me, don't tell her.
Right. Okay. Can I just reassure you, Stephanie, that anything you say to me today is absolutely confidential. If you don't want me to or us to involve anybody else, that's entirely up to you. But I think it would be a good idea to get an adult involved as well. It doesn't necessarily have to be your mom or it can be anybody, a friend of yours that's an adult. That's absolutely fine as well. Now, can I just ask? So, what are your thoughts about it?
Just really scared, and I don't know what I want to do. I don't really want to be a teenage mom, but don't know. I know about abortion and that people have them, but I don't know what's involved, and it just sounds really horrible. So I don't really know what to do. So I thought I'd come here.
Right. Okay. Now, yes, there is. First of all, we need to double check the pregnancy test. Okay. So, if you're happy, I'd like for us to just. I'd like for us to do a urine test. Okay, just to confirm, the pregnancy, and also check for any evidence of infection in your urine. If that's something you're happy to go ahead with.
Yeah.
Yes.
It's pregnancy test positive, urine dip's normal.
Right. Okay. So, based on that, I'd like to say that yes, there's the option of, depending on what you would prefer to do, the termination or obviously keeping it. Both of those obviously have their pros and cons. It's not without risks when you consider termination of pregnancy. Generally speaking, it would be of either involving you taking a tablet which you would take, and then they monitor you for a period, and then you go back again and take a second tablet. And
So I don't have to have an operation if I want an abortion. I can just have a tablet.
well, you could. There's that option, okay, and there's the option, obviously, of checking. I mean, doing the operation, which is basically a situation where they go in and actually do an operation to get the fetus out. Now, I need to double check. You said your last period was 5 weeks ago. Right. Okay. And do you normally get regular periods?
Yeah.
Right. Right. Okay. That's fine. And have you had any bleeding at all recently? No. Any discharge? Right. Okay. Now, do you normally use any form of contraception?
We were using condoms and one broke, so I think it's probably because of that.
I see. Okay. That's fine. And relatively personal, and I'll completely understand if you don't want to, go into this, but I need to clarify, your partner, how old is he?
He's in my class at school.
Right, okay. And I take it this was consensual then?
Which is
By that I mean that you were in agreement about, you have had, about the sexual encounter, you were in agreement?
Yeah.
Right, okay. That's fine. So have you had a discussion with him about it as well?
Yeah, he didn't say much.
Right.
It's just a bit like, I don't want to be a dad,
I see.
sort of thing. So, not much help really.
I see. Okay. Right. Okay. So, like I said, we've got either of those options, but the truth is, I think it will be worth you taking a little bit of time to think about it. Like I said, there's pros and cons for either
So
way.
have I got time to, I don't have to make a decision today? 'Cause
I
know-
wouldn't. Yeah. Go on.
I just know there's like, sometimes you can have abortion, sometimes you can't, it depends how pregnant you are. I read about that, so I don't have to make a decision today then.
No. Yes, I can tell you that you don't necessarily have to make a decision today based on your last menstrual period. We can make a very rough guess as to how far gone you would be. Now, based on that, assessment, then we can say that you do have at least a couple of weeks to 3 weeks to play with. In which case, I'd implore you to, have a good think about it. And like I said, I think it's a very good idea to also involve someone, an adult, basically. Because sometimes you just need somebody there to give you a little bit of support and guidance at times like this.
Should I come back with my mum? Would you tell my mum for me?
If that's something you would like for me to do, I'm happy to do that for you.
Might be easier.
Okay. Yeah, that's absolutely fine. So what we could do is I could book you into a clinic of mine next week. At which point, you could have had a good think about it, possibly discuss with your partner as well. And obviously when your mum comes in, if you want me to mention it to her then, if you would rather not mention it already, that's absolutely fine. Is that okay?
That would help, yeah. That would
Okay.
help. And so, do you do the abortions here, like the tablet ones, or would I have to go somewhere?
Right, usually we would need to refer you on to a specialist clinic where they would be doing it. I need to fill out a form and do a referral for you. And one of the other doctors would have to go through the details as well and make sure that they're happy. The other thing I needed to mention is, obviously, it's probably something we'd be booking an appointment to talk about in future as well, about contraception. Okay?
What if I have an abortion so it doesn't happen again?
Correct.
Yeah, I need to think about that, I suppose.
Yeah. So I would encourage, obviously, we'll see you next week about, speaking to your mom. But I think it would be a good idea also somewhere at some point in the future to talk about, how to prevent it, especially if we're going down the route of abortion in this instance. Is that all right?
And if I do choose that, I think I'm leaning more towards getting rid of it, but if I did want to keep it, then what do I do then?
Right. Basically, if you needed to, if you decided to keep the baby, what we'll be doing is would be we could use the next consultation to book you in. So we need to book in the pregnancy in the first place. What we'll do is fill out a few forms, quite a few forms that we would fill out, quite a few what would I call them now? Concessions that you get for the pregnancy and things like that. We'll be giving you a form. We'll be booking you for a first scan, which usually would happen, about 10 to 12 weeks into the pregnancy. We'll also be organising some blood tests for you. We might need to check your iron levels and things like that. Make sure you're not diabetic.
There's quite a lot to do.
Yeah. I mean, I think it's something we'll need to talk about when you need to,
When I've
if you go on,
decided.
to make that decision.
Okay.
Is that right? Was there anything else you wanted to?
No, that's enough, I think. So
Sure.
thanks. Yeah, so I'll book an appointment and come back and see you with my mum, I think, because it might make it easier.
Oh, okay. All right.
Thanks.
See you then. You're welcome.
Good. So, what do you think? How did it go?
I think I've come with this, impression that there's always a hidden agenda. It felt like it went too smoothly.
It's fine.
Alright. Okay, I started with an open-ended question. Yes, but I think I interrupted quickly as well, and then went back to open-ended questions.
Yeah. Yeah, you did fire a few questions at the
Yeah,
beginning.
initially.
Yeah.
I wasn't sure how to deal with how more open-ended I could have been at the start.
Yeah.
Then I think I reassured her of confidentiality if she didn't want anybody to know.
Yeah.
I
Having reassured her in that way, what would you have then done if she said her boyfriend was 34?
yeah.
Which was true. You were nicely reassuring,
Mm,
but you have to include that caveat. Everything we say is
Unless-
confidential,
mm,
unless we're worried that that you might be in danger or
Mm,
else.
right.
So, I think what you said was very nice,
mm,
but just to include that caveat, just so you don't catch yourself
Catch
out.
yourself.
Because although there was no hidden agenda in this
mm,
case,
mm.
you never know. Could have been. Anyway,
Okay.
carry on. Sorry, I interrupted.
And no, that's fine. And I think I explored whether she. I tried to establish that she was competent, which it sounded like she was.
Yeah.
I explored whether she was using any form of contraception. I explored the fact that she needs to be on some contraception, in the future, which would be a discussion about. A future discussion.
Yeah.
I established the fact that it would be a good idea to think about it and not rush into doing
Yeah,
anything.
absolutely.
Given the fact that she did have at least a couple of weeks to play around
Yeah.
with. I did. What else did I do?
So you did a few things. You wanted to double check, didn't you?
Mm,
That there was. I think again you were thinking about the hidden agenda.
yeah.
You were kind of wanted to check that she wanted to have sex. And
Right,
there
yeah.
was anything else going on there.
That felt a bit awkward in the way that you
Yeah.
asked me as a 15-year-old. I wouldn't have known what on earth you were on
Yeah.
about.
Yeah.
With
I
the
know
greatest
what you're
respect,
saying.
and it's difficult to say to know how to say that.
Yeah.
But
I think what you can maybe in this sort of a situation, the sort of thing that you might want to think about is saying, and was the decision to have sex one that you came to together? You can kind of.
So what term did
So you
consensual?
said, was it consensual? And she said, I don't know what you mean. And you said, were you in agreement about this
Right.
sexual encounter?
yeah. Like an
Extremely
embarrassed.
formal. Yeah. So,
Okay, so sorry. To say, how would you? What would be a bit of better way of saying
so I
that?
think what you could perhaps say
Because I
is
just
to say,
came up with
okay,
that.
so you and your boyfriend are in a relationship and you've had sex, and did you come to the decision to have sex together?
Right, okay.
And although there's no kind of right or wrong response that she might give, I think if you got the impression from what she said that she'd been coerced into having sex, then that's different. If she was kind of sort of hesitant, you could say, did you feel any pressure?
Right.
Did you feel you were put under any pressure to have sex? it's just kind of, you know, just a subtler way of doing it.
Okay.
So I think overall, you know, you've got appropriate history. It was a little bit closed at the start, so she said she was pregnant, and you were like, when was your last period? How many tests have you done? And then sort of straight from that, you then went into, are you here by yourself? And then, you know, you were then talking about getting an adult involved, which is fine. You know, it's all kind of relevant stuff, getting the mum involved and everything else, but it would probably have felt more natural and you'd have built up a rapport quicker if you put that bit to one side temporarily. So ask about the history, ask about what happened, ask about what the options are, ask her about who she's spoken to about it, and then to talk about maybe, you know, talking about encouraging her to get her.
So not earlier on, because I was a
Yeah.
little bit, maybe I should have mentioned it at the start.
No, not
So
at
much
all.
later
Because
on.
if a 15-year-old is completely entitled to make their own appointment and come to see you on their own, and you know, so she's the one coming to give the history. She's the one that wants to see a doctor. So it's fine to explore the history, and then to talk about, you know, perhaps it'd be supportive for you to get your mum involved. And I knew exactly what you meant, but I think that the way you phrased it is slightly paternalistic, because you said, I think it's important to get an adult involved, which implies because you're a child. So, you know, I think that's just something to be aware of. I think, you know, you went on from there and actually it was much more balanced to start off with. I think I was a bit concerned at the start you were going to be quite paternalistic, because you were sort of talking to her in a little bit of a, hello.
Yeah.
Well, to be perfectly honest, I've had all the cases, you know, wrong arrangements. So I wasn't sure. Are you grown up now? Are you young? I was trying to get that in my mind.
But as I say, I think, you know, the management that you came up with was entirely appropriate. A few little things that maybe need to be slightly less formal, but you don't want to become less formal but then become too sort of childlike. You have to think of these people as like young adults.
Okay. Thank you very much. Is that it then?
That's it.
Okay.
If you go back upstairs,
Oh, okay.
and then I think you go to general